Thank you very much. Good morning, everyone. And thank you very much for the invite to talk about this today. So I'll start with this map of the European region. It's a huge landmass ranging from Portugal on the Atlantic coast in the west to Russia in the east, with its coast on the Pacific. And it's home to 53 countries, as well as Kosovo and Liechtenstein. And in the EU, there are around 450 million people. Russia, 146 million people, by far the largest country and largest largest population. And Central Asia with 76 million people. And for the purposes of UNAIDS, the region is actually divided into two regions. So we have Western and Central Europe, which is often grouped with North America, and then Eastern Europe and Central Asia. And the reason for this is that Western and Central Europe is consisting of mainly high-income countries, while Eastern Europe and Central Asia, until this month, was entirely consisting of middle-income countries, although Russia was just reclassified as a high-income country by the World Bank. There are three armed conflicts in the region. There is the Russian invasion of Ukraine, there is the Armenian occupation of Nagorno-Karabakh in Azerbaijan, and there is the Israel-Gaza conflict. And I will mention Ukraine, but not the other two, mainly because there are more data available for Ukraine. So this slide shows people, adults and children, living with HIV in the European region. So we have around 2 million people and 5% of the global total living in Eastern Europe and Central Asia, and about 1 million people and 3% of the global total in Western and Central Europe. And the graph on the left shows the global AIDS-related deaths for children, 0 to 14 years for the last decade. And the same trends are for adults and children globally, where we see a large decline in AIDS-related deaths over the last 20 years. We see similar declines for new infections globally in adults and children. But when we dig deeper and look at regional differences, there are different trends going on. So on the right, we have the percentage change in AIDS-related deaths between 2010 and 2023 for different regions. You can see a decline for Western Europe, Central Europe and North America. But for Eastern Europe and Central Asia, this is the only region where AIDS-related deaths are increasing. Similarly, for new infections, Eastern Europe and Central Asia is one of three regions where new infections are still increasing. So because of this, the main focus of my talk for HIV will be on Eastern Europe and Central Asia, and I've listed the countries there on the right, and they're colour-coded by whether they're reporting to UNAIDS. So the countries in red are not reporting to UNAIDS. The countries in green, we have UNAIDS estimates, and I'm using the estimates for 2023 in the presentation. And the countries in red, we have the most recent data are national data. So there are challenges of variable HIV reporting in Eastern Europe and Central Asia. We also have no HIV 2023 data for Western and Central Europe. This is because Western and Central Europe report first to the European Centre for Disease Control and Prevention, and then they report on to UNAIDS. This causes a reporting delay, and so these data are not available for the new report coming out next week. We also have very sparse, very patchy and quite old data for hepatitis B and hepatitis C, and I'll come on to that at the end. So I'll be talking about maternal HIV, vertical transmission prevention, then move on to children and adolescents with perinatal HIV, and I'll flip from Eastern Europe and Central Asia back to Western and Central Europe. Then a note about HIV discrimination, and then on to hepatitis B and hepatitis C in pregnant women and children. So this table shows some key indicators of HIV in pregnant women in Eastern Europe and Central Asia for 2023. The middle column is the HIV testing in pregnancy coverage, and the column to the right, the number and proportion of pregnant women living with HIV. And the countries above the red line are countries reporting to UNAIDS. And we can see very high, impressively high HIV testing and pregnancy coverage in these countries. And then for those countries reporting to UNAIDS, quite small numbers of pregnant women living with HIV compared to globally. But for the Russian Federation, national data suggest a prevalence of over 1% HIV in pregnant women in 25 regions, and for Ukraine, 0.7%. Moving on to global and regional HIV vertical transmission in 2023, the global rate of HIV vertical transmission was estimated to be 10%, for Eastern Europe and Central Asia, 7%, and for Western and Central Europe and North America, less than 1%. But when we dig down into different trends in different countries in Eastern Europe and Central Asia, there are different things going on. So this graph shows the vertical transmission rate on the y-axis, and then the year from 2020 to 2023 on the x-axis. And the grey dotted line shows a 2% elimination of mother-to-child transmission target. So starting with the red line, you can see the overall rate of vertical transmission over these countries for the last 4 years, and there's been no decline in this overall rate. Most of the countries, there's been some decline over the period. And then underneath the red line, you can see Armenia, Russian Federation, and Ukraine with low and declining levels of vertical transmission. Now, Armenia was validated for elimination of vertical transmission a few years ago, but this validation only lasts for 3 to 5 years, and then a country needs to be revalidated. And on the right, there are the list of countries which are initiating the path to validation in yellow, although this path is quite a complicated path and a number of different indicators need to be met. Here we're moving on to children living with HIV and the cascade of care of children versus adults, both globally and in Eastern Europe and Central Asia. So these are the global data. So we estimate that 66% of children globally know their HIV status, 57% on ART, and 48% virally suppressed, with higher estimates for adults, 87, 77, and 73%. We see different trends in Eastern Europe and Central Asia. So for the children, they're doing better in this region than globally at 75, 73, and 63. But on the right, you can see how adults in Eastern Europe and Central Asia are actually doing worse, 59, 50, and 42. UNAIDS estimates that around 14,000 children are living with HIV in Eastern Europe and Central Asia. So these cascade of care figures interpret really into there being a quarter of children not being diagnosed and not being on ART, and a third of children not virally suppressed. And in terms of the largest burden countries, the estimates suggest that in Russia, Russia national data are that 615 children were newly diagnosed in 2022, and in Ukraine, around 3,300 children living with HIV in 2023. Switching back to Western and Central Europe, these are just some studies that we've been doing in EPIC, our European Pregnancy and Pediatric Infections Cohort Collaboration. This is mainly countries in Western Europe and Central Europe in EPIC, and we have European cohorts with very long-term follow-up throughout pediatric and often adult routine care with quite high-quality data and low loss to follow-up. And just to flag a couple of the analyses that we've been doing recently, both across EPIC and individually within countries, we've been looking at transition to adult care. So analyses from the Netherlands and the UK suggest that 30 to 40% of young adults with perinatally acquired HIV are not suppressed at transition to adult care. And also data on pregnancies in women with perinatal HIV from Spain and from the UK. Small numbers, but suggesting that most infants are born HIV-free, but some challenges of management with around 40% of these young women living with perinatal HIV having detectable viral load at delivery in the UK, 19% in Spain, and then some very poor postpartum outcomes recorded in the Spanish study. Just to flag with Ukraine, Ukraine is a very strong and valued partner within our EPIC collaboration. The WHO has a surveillance database recording attacks on healthcare settings and has recorded nearly 2,000 attacks on healthcare in Ukraine since the Russian invasion in 2022. There's also been a decrease in HIV testing in the country, but there has been this huge, enormous, very impressive effort to ensure supplies of diagnostics and ART across the country and follow-up of lost patients using quite innovative methods. And you will have seen from a couple of slides ago that they've maintained their success in preventing mother-to-child transmission. Just a note about discrimination against people living with HIV. These are data from national surveys around the globe which ask two questions. So firstly, would you buy fresh vegetables from a shopkeeper or vendor if you knew that this person had HIV? And also, do you think that children living with HIV should be able to attend school with children who are HIV negative? And so you can see on the y-axis a percentage answering no to either question. And I've highlighted the Eastern Europe and Central Asia results, only 3 countries where we have data, but incredibly high levels of discrimination. So the Global Partnership for Action to Eliminate All Forms of HIV-related Stigma and Discrimination has a 10% target. They want countries to be under 10%. And you can see only one country, Eswatini, is under that level at the moment. And 7 European region countries are members of this partnership and have committed to this target, but not the 3 in the graph. So moving on to hepatitis B in pregnant women and children. Hepatitis B is part of triple elimination of mother-to-child transmission of HIV, syphilis and hepatitis B, and there are around 19,000 new cases and 43,000 deaths each year across the region, with low prevalence in Western and Central Europe, but a much higher prevalence in some countries in Eastern Europe and Central Asia. There is a new WHO recommendation to provide TDF prophylaxis to all hepatitis B surface antigen positive pregnant women where HBV DNA and hepatitis B E antigen testing is not available. This is in recognition of how much of the burden of hepatitis B is attributed to vertical transmission, and also the fact that acquiring hepatitis B early in life leads to higher levels of chronicity. By 2021, virtually all of the countries in the region should have implemented universal childhood hepatitis B vaccination, and 7 countries had reached European targets for hepatitis B control. So this was vaccination coverage for birth dose and subsequent doses, screening in pregnancy and PEP for infants, and then serosurveys showing that there has been impact in those who've been vaccinated. This slide shows the 2020 coverage of 3 doses of hepatitis B vaccine in children living in EU and the European Economic Area countries implementing universal hepatitis B vaccination. And the WHO target for 2020 is 95% coverage. So at least half of the countries are not meeting this 95% coverage level. A couple of countries are not providing any data, and a couple more countries do not have a national policy. Moving on to hepatitis C in pregnant women and children, there are really big data gaps for hepatitis C in pregnant women and children. This is partly because globally, hepatitis C screening in pregnant women is uncommon. The data in the table to the left are from 2 large systematic reviews in pregnant women and in children looking at prevalence of hepatitis C antibody, suggesting a global prevalence of just under 2%, similar in Western Europe for pregnant women, and lower in Central Europe and Eastern Europe at just under 1%. And then for children, the highest burden in Eastern Europe and Central Asia. And on the right, there are the elimination targets from the WHO. CHI data suggests that generic DAA procurement is lower now than before the COVID-19 pandemic, except for India and Pakistan, suggesting that DAAs and hepatitis C may have gone off the radar for many countries. When we look at DAA prescribing, DAAs are licensed for pregnant women before they become pregnant and after breastfeeding, and for children from the age of 3 years. But they're not licensed for pregnant women or breastfeeding women or children under 3 years of age. The rationale is that women could be treated before they become pregnant, but there's no clear pathway to screen and treat women before they conceive. Similarly, women could be treated after breastfeeding, but in many countries, women breastfeed for extended periods and have pregnancies in quick succession. For example, in Pakistan, women breastfeed for around 2 years. Similarly, treating in childhood is a challenge because there is over 50% loss to follow-up of women and infants in the treatment cascade after delivery. And increasingly, off-label use in pregnancy is reported from several countries. So we really need much better data on safety of DAAs in pregnancy and in breastfeeding. And I'm just flagging here the TIP Hep C registry, which is a registry of DAA use in pregnancy by the Coalition for Global Hepatitis Elimination. So please, if you know of cases of DAA treatment in pregnancy, please report them to this registry. So in conclusion, there are weaknesses in country reporting to UNAIDS, and then there are differences in reporting systems between UNAIDS and ECDC. So this leads to gaps in indicators and inconsistencies in data provided, and we need stronger advocacy to close these gaps. There are ongoing threats from conflicts in the region, and we really need to continue to ensure that we're meeting the needs of women and children in unstable countries. We've seen great success in diagnosing pregnant women with HIV and reducing vertical transmission, but there is still a way to go. And there are large data gaps for both hepatitis B and hepatitis C. We need to continue to strengthen hepatitis B vaccination in infants across a region, and urgent need for studies assessing safety of DAAs in pregnancy and breastfeeding. So just my acknowledgements. I'd like to thank all of the people in the European Pregnancy and Pediatric Infections Cohort collaboration. Thank you so much for your great collaboration over the last years. Thanks to Mary and everyone contributing to the UNAIDS datasets. I've obviously relied heavily on those in this presentation, so big thanks to them and for the early access to the data. Thanks to Alla for the Ukraine data and for her review of my slides. And to Annette Sohn, she did this talk last year and did a really impressive talk, and I've borrowed heavily from her structure. And then thanks to my colleagues Jeannie, Siobhan, Carlo, Hermione, Claire and Anna for their review and feedback on my slides. Thank you.